Hi, I'm nursing student Jason. Today I am going to be administering an insulin shot for you. I just want to make sure that you are the person I think you are. And let me go ahead and get your name and date of birth. All right, yep, that's you. And according to if I needed to, if this person is about to eat or something, I want to know what the blood glucose level is. So I would probably check their blood glucose level. So right now, all right. So I'm going to I'll be administering your shot, and it's going to be right in your abdominal region, about 2 inches away from your umbilicus. Is this where you normally take your insulin? Okay, good. All right. Well, then you're used to this. Well, I'm going to go get ready. I'll get your supplies, wash my hands and everything, come back, and then we'll just get her done. All right. Be right back. All right, so now I'm going to get my hands wet, going to get a little soap. I imagine that was about 20 seconds. I will put on some gloves, which I believe I have gloves over here. So at this time, before I even get my insulin out, I want to look at my the orders, make sure the right person with the right indication is going to be receiving their meds. So I want let's see, I've got the medication, patient, dosage, time, route, and eventually documentation. I'll have to document in the very end. And so anyway, the first thing I would do, I would get it out. So got the 2 different types here. I want to make sure that I know how many units of each type I'm going to be giving. So I would look at the orders, and this is the second. So the first time I looked at the orders to get them out. The second time I'm also looking at the orders to make sure I know the dosage. So I'm going to want 10 of the cloudy and 2 of the not cloudy. So I can go ahead at this time and stir that. Make it nice and stirred up real good. Looks a little cloudier on the bottom, but for the sake of timeliness, I'm going to say that it's nice and clean. Or nice and clean. I'm going to say that it's nice and stirred. There's one, and then I will clean the other. Let that dry. Should take about 10 seconds. In the meantime, I'll go ahead and get my insulin syringe, and I will draw 12 units worth. Of air. Is that 12 units, nurse?
Yep.
Thank you. All right, so now what I'm going to do is take that off, and I'm going to put 10 units of air into the N. I want to leave 2 there. Okay. And then, is that, so there should be 2 left.
Okay.
Okay. And I'll go ahead and put 2 more in here. And then I want to draw 2 from the, it's a little awkward the way I got this here. Two.
Yeah.
All right. And actually, draw 10 more. So I'll end up with 12 altogether. Eleven, 12. Okay. Using the scoop technique, I'm going to put the cap back on that and going to place this. Well, I want to label this as well, so I don't have a pen on me, but oh, wait a sec. Voila! I found a pen. So I'm going to put the patient's name, date of birth, MAR number, medication, and dosage. It'd be N10 R2, and then I can put this in my receptacle that I will carry to the, instead of just carrying a syringe, I'll carry this over to my patient. And then I'll also, while I'm here, I'm going to verify that the patient is who I think they are again. Maybe I walked into the wrong room. Can I get your name and date of birth? Okay, that's you. And according to my records, that's you. And I want to make sure that I'm looking at the order again. I want to know I've got the right medication, the right, let's see, the right patient, medication, dosage, route, time, and documentation. But so at this, now that I'm in the room, I'm going to want to, that's in the receptacle, I want to clean my hands again, and I want to glove again. So, and probably have to sanitize my hands, and I don't know what I put with my gloves, but there'll be 2 more gloves on the wall. Oh, I'll use these. Thank you so much. These are cozy. All right, so at this time, I'm going to come over and I would tell the patient what I was going to be doing, and just trying to keep modesty. I'm just going to reveal just the area that I'm going to be working with, and I would make sure that I'm at least 2 inches away from the umbilicus. That's actually the umbilicus, not this. So 2 inches away from the umbilicus, and then I would grab the fat and pinch it, and then I would place it. So I'm going to do that, and this is the gauze that I'm going to be using to afterward. So, oh. Oh yes. Thought I was missing something. Before I get started, I want to, so I'm just gonna clean this area right here. pinch that. I'm just gonna hold that. I'll go, actually this is supposed to, so I'll go. So goes down. And then at this time, I'm just going to place this right into the sharps container for training purposes. I'm probably just going to put it back in my bag so I can reuse it again. And I'll pretend that I am not just recapping it. Went in the sharps. And then I'll look at this and make sure that it's not bleeding or anything. I can tape it down, and yeah, I think I'm done. All right, well, thank you, and I hope that wasn't too painful. At this time, I'm gonna go ahead and take off my gloves, hand sanitize, and then document everything I just did. Make sure that the patient is comfortable, and make sure that they have their call light, and then I'm done.